Fever. Fever, this is nothing but the when higher than the normal body temperature we have. It is a sign that your body's natural fight against the infection. So for adults, a fever is when your temperature is higher than 10.4 degrees Celsius. For kids, a fever is when the temperature is higher than 10.4 degrees Celsius measured rectally, and if it is measured orally, it should be 99.5% 5 degree Fahrenheit. So, or 99.99 degree Fahrenheit measured under the arm. The average normal body temperature is 98.6 degree Fahrenheit, while speaking in the Celsius scale, it is 37 degrees Celsius. So, when you or your child's temperature rises a few degrees above the normal, it is a sign that your body is healthy and fighting against the infection. In most cases, that is a good thing. But when a fever rises above the 1 or 2 degree Fahrenheit, it should be treated at home, and it is necessary by your healthcare provider if the fever doesn't go down after a few days. A fever, this is a temporary increase in your body temperature after due to an illness. Having a fever is a sign that something out of the ordinary is going on in your body. For an adult, a fever may be uncomfortable. That is usually isn't a cause for the concern unless it reaches the 1 or 3 degree Fahrenheit. For infants, a slightly elevated temperature may indicate the serious infection. What do I do when my child has a fever? So, with most cases, a slight fever isn't a cause for the concern with children. A low fever can make a child uncomfortable. It isn't unusual for them to seem unaffected, still playful and eating and drinking normally, though maybe a little tired. Their fever should resolve in a few days. With the higher fevers, call your child's healthcare provider. If your child's fever lasts more than 5 days, it's higher than 1 or 4 degree Fahrenheit, the fever is not reduced by medication such as ibuprofen, acetaminophen. Do not give a child under the 17 aspirin due to the risk of Ray's syndrome. You are concerned that the child isn't behaving in their usual way, or anything else make you uncomfortable with their fever or illness. Some children have the frightening side effect to fever called the febrile seizures. This happens in 2 degree to 4 degree of children under the age of 5. Some seizures causes the jerking movements, or it may look like your child has passed out. When this happens, put your child on their side. Do not put anything in their mouth and call 911. If the seizure lasts more than 5 minutes or the child lips turn blue. If it lasts less than 5 minutes, notify your healthcare provider and go out and get their medical attention right away. So, if you have symptoms like sweating, chills, shivering, headache, muscle aches, loss of appetite, irritability, dehydration, and general weakness. If you have a fever when your temperature rises above its normal range, what's normal for you may be a little higher or lower than the average normal temperature by 98.6 degree Fahrenheit. Children between the age of 6 months and the 5 years might experience a febrile seizure. About a third of the children who have one febrile seizure will have the another one, most commonly within the next 12 months. Here we can say the symptoms of the fever. The main symptoms of a fever like you have an elevated body temperature that is above 100. You may also experience a chills, shivering and the shaking, body aches, headache, fatigue, intermittent or the constant sweating. You have the flushed complexion of a hot skin. What causes a fever? A fever has many causes and can be a symptom of almost any illness. Among the most common, I listed some of them here. One is the cold or the flu, and people have the earaches. They are also affected by bronchitis, They feel like strep throat. That is, you can feel a sore throat. You are also affected by the urinary tract infection and mononucleosis. However, if you or your child are experiencing the higher than the normal body temperature and to the adult symptoms of illness, don't assume something is wrong. A person's body temperature changes throughout the day and varies with many normal activities and the emotions. For example, stress, excitement, heavy clothing, and the food, certain medication, a menstrual cycle, and the exercise can also raise the body temperature. Also, the children tend to have the slightly higher body temperature than the adults. So, I will say a better one like taking a temperature. How to take a temperature? You can choose from the several types of thermometers like oral, rectal, ear, and the forehead. Like you can take it in the temporal artery. So, oral and the rectal thermometers generally provide the most accurate measurements of the core body temperature. Ear or the forehead thermometers, also convenient, they provide the less accurate temperature measurements. In infants, doctors generally recommend taking the temperature with the rectal thermometer. When reporting the temperature to your or your child's doctor, give the reading and explain how the temperature is taken. So, what is the best way to measure the temperature is, as I said, you can use a thermometer inserted orally, rectally, or under the arm, or by using the special instrument commonly sold in the stores, that is inserted in the ear and measure the temperature of the eardrum. Can a fever be treated at home? So, if a fever is mild, then no medical treatment is required. Simply make sure that you drink the plenty of fluids, not alcohol, and get the plenty of rest. For higher temperature, there are many effective ways to getting your fever under the control. The most common way includes medications such as aspirin, acetaminophen, ibuprofen. If you have a child under the age 17 who has a fever, do not give the child aspirin. Aspirin in the children may cause the Ray's syndrome, a sometimes fatal illness. Taking a lukewarm bath around 90 °F may also help bring the body temperature down. So, I'll say when to see a doctor. Fever by themselves may not be cause for alarm or a reason to call a doctor. Yet, there are some circumstances when you should seek the medical advice for your body, your child, or yourself. For infants, an unexplained fever is greater cause for the concern in the infants and in the children than in the adults. Call your baby's doctor if a child is younger than age 3 months and has a rectal temperature of 100.4 °F or the higher. Between the age 3 and the 6 months, has a rectal temperature of up to 102 °F and seems unusually irritable, lethargic, or the uncomfortable, or has the temperature higher than 102 °F. If you have between ages 6 and the 24 months and has a rectal temperature higher than the 102 °F that lasts longer than the 1 day but shows no other symptoms. If a child also has a higher other signs and symptoms such as cold, cough, or the diarrhea, you might call your child's doctor sooner based on the severity. So, fever diagnosism. Although a fever is easy to measure with a thermometer, finding the cause can be the hard. Besides a physical exam, your doctor will ask about your symptoms and conditions and what are the medications you took. You have recently traveled to areas with infection or have any other infection risk. A malaria infection, for example, may cause a fever that typically comebacks. Some areas of the US are the hotspots for the infections such as Lyme disease and Rocky Mountain spotted fever. Fever occurs when an area in your brain called the hypothalamus, also known as the body's thermostat, shifts the set point of your normal body temperature upward. When this happens, you may feel chilled and add the layers of clothing or wrap up in a blanket. You may shiver to generate more body heat, eventually resulting in an elevated body temperature. The fever or elevated body temperature might be caused by the virus or the bacterial infection. Heat exertion, certain inflammatory conditions such as rheumatoid arthritis, malignant tumor, some medications such as antibiotics and the drugs that used to treat the high blood pressure or the seizure. Some immunizations such as diphtheria, tetanus and the acellular pertussis or the pneumococcal vaccine. Fever treatment. Fever is usually treated with the physical discomfort, and most people feel the better when a fever is treated. But depending on your age, physical condition and the underlying cause of the fever, you may or may not require the medical treatment for fever alone. Many experts believe that fever is a natural bodily defense against the infection. There may also some non-infection that causes the fever. Treatments vary depending on the cause of the fever. For example, antibiotics would be used for the bacterial infections such as strep throat. The most common treatment for the fever include counter drugs, acetaminophen, and the non-steroidal anti-inflammatory drugs such as ibuprofen and the naproxen. Children and the teens should not take the aspirin because it is linked to the condition called Ray's syndrome. And the ways to lower the fever at home include, you can have the drinking a lot of clear liquids such as water, broth and the juices or the rehydration drink. Taking a lukewarm bath. You can take a rest, keeping yourself cool with the lightweight clothing and the bed covering. So what are the home remedies of the fever? An individual with the fever should be kept comfortable or not overdressed. Overdressing can cause the temperature to rise further. The tepid water bath or the sponge bath are the home remedy that may help bring down a fever. Never immerse a person with a fever in the ice water. There is a common misconception. Never sponge a child or an adult with the alcohol. The alcohol fumes may be inhaled, causing them many problems. Other home remedies for the fever include staying hydrated, drink plenty of water and the fluids, and avoid the alcohol or the caffeinated beverages, which can contribute to the dehydration. Popsicles, they can also be cause cooling and provide the fluids, which also cause the soothing a sore throat if that is present. A fan to circulate air or open window may be helpful, as well as helping a cool damp washcloth to the forehead. If you are carrying for a child, make sure the child does not feel too cold. So here I will give a short intro about our fever. So fever, this is a temporary increase in your body temperature. This is often due to illness. Having a fever is a sign that something out of the ordinary is going into your body. So fever generally go away within a few days. A number of over-the-counter medication lower a fever, but sometimes it is better left untreated. Fever seems to play a key role in helping your body fight off a number of infections. So if you have symptoms like sweating, muscle ache, loss of appetite, dehydration, general weakness, if you have a chills and shivering, you may seem to have a fever. So children between the age of 6 and 5 might experience a febrile seizure. You can take a temperature. So you can choose from the several types of thermometers like orally, rectally. You can use a temperature with the ear and the forehead. Oral and the rectal temperature generally provide the most accurate measurement, while if you are using the ear or the forehead thermometer, it is also convenient but provides a less accurate temperature measurement. So when you can see a doctor, fever by themselves may not be cause for alarm. Younger than the age of 3 months, as the rectal temperature 100 degrees Celsius, 100 degree Fahrenheit or the higher, you can see a doctor. If If your age is between the 6 and the 24 and the rectal temperature is 1 or 2 degree Fahrenheit, that lasts longer than 1 day but shows no other symptoms. If a child also has other signs and symptoms such as cold, cough, diarrhea, so better go and meet a doctor. For adults, if you have a headache, unusual skin rash, unusual sensitivity to bright light, mental confusion, persistent vomiting, difficulty in breathing or chest pain, abdominal pain or pain when urinating, convulsion or the seizure, better go and meet a doctor. So causes. While speaking about the causes of fever, occurs when an area in your brain called hypothalamus is affected. This is caused by the virus or the bacterial infection, heart exertion, and the inflammatory conditions such as rheumatoid arthritis, malignant tumor, some medications such as antibiotics and the drugs, which is used to treat the high blood pressure or the seizure. Some immunizations such as diphtheria, tetanus, and the acellerated hepatitis or the pneumococcal vaccine is also affected. So complication. Children between the age of 6 and the 5 may experience a fever-induced convulsions. They remove the any sharp objects that are near your child. So you also use a loose and tight clothing. Hold your hand to prevent the injury. Don't place anything in the child's mouth or try to stop the seizures. We can prevent it by wash your hands often and teach your children to do the same, especially before eating, after using the toilet, after spending time in the crowd or around someone who is sick. Show your children how to wash their hands thoroughly. Carry the hand sanitizer with you for times when you don't have access to soap and the water. Try to avoid touching your nose, mouth or eyes, as there are many ways that viruses and the bacteria can enter your body. Cover your mouth when you cough and nose when you sneeze, and teach your children to do likewise. Avoid sharing cups, water bottles and the utensils with your child or the children. So these are the best ways to prevent yourself from being affected by the fever. Thank you.